Key considerations should be assessed and evaluated prior to the implementation of any business plan. For this business scenario, areas of focus that were examined included leadership's involvement, technology and infrastructure, policies, licensing and credentialing, privacy and security, and marketing. Areas of focus or key considerations can be brought to light through the utilization of a needs assessment. A SWOT analysis is one tool that can be used to determine if a need is present and can offer a business plan drive and potential. Leadership engagement is vital to the success of a plan. When the team feels that their leader is engaged, they become receptive and aligned to organizational goals. Resistance to change must be assessed, and a plan of action must be created to determine if this hurdle could be overcome. By having a plan of action to tackle resistance, this threat could reduce the time placed on efforts to implement change. The current states of technology and infrastructure is the basis for a telehealth program, and this must be of top priority for implementation. Vendor selection should have a needs assessment of its own and should be tailored to the needs of the program. Reimbursement assessment and working with payers to establish pay practices must be taken into consideration to determine if profitability is likely. Licensure and credentialing needs, as well as cross-state country requirements, must be evaluated and obtained prior to the implementation of this program. Without the appropriate credentialing, this program cannot get off the ground. Ensuring that security and privacy concerns have been addressed and established is crucial. They stipulate the conditions under which an electronic health record can be accessed, by whom, and when, making HIPAA compliance and data security even more important than ever before. And finally, marketing is a key consideration in the adoption of a telehealth program. Once the need and demand is established, a target audience can be solicited through news media, brochures, and networking. In performing a needs assessment, the SWOT analysis noted on this slide was performed. The strengths of this project would include meeting consumer demands, improve patient wait times, the ability to offer referrals and emergency resources, and of course, increase patient access to care for all patients, especially for patients who cannot get to an emergency room or urgent care clinic. Patients who are unable to take the time off of work to sit in a waiting room for hours to be seen, and patients who do not require extensive workups, but rather a quick evaluation. Conversely, weaknesses include a lack of education and technology used for patients and staff, patients wanting their medical evaluation to be done in person, staff fear of losing employment, the physical environment not being appropriate for evaluation, resistance to change, and of course, this technology could be limited to specific chief complaints, such as fast-track patients with ESI 4 and 5. Opportunities include interoperability opportunities for incorporating EHR and other healthcare systems, and its impact on patient satisfaction metrics. Threats included rapid changes in technology requiring more training and education, and billing and payment as it relates to limited reimbursement and insurance coverage. The identified internal and external factors will help aid in the success of this program's implementation. It is imperative that attention to key considerations regarding weaknesses and threats be given as to eliminate any possibility of failure. Based on research and evidence, we have determined that this program offers several patient benefits. However, we must now determine if this program is financially beneficial as well. Therefore, a proposed budget and justification was created.